What's up, guys? For this week's current events, I did my post over the Boston EMT who was brutally stabbed by a patient in an ambulance. So this obviously took place in Boston. A first responder underwent emergency surgery after being stabbed multiple times by a patient she was treating in the back of the ambulance while en route to the hospital. It says the patient was a 31-year-old emotionally disturbed female who began the attack on the way to the hospital. The male EMT who was driving heard the commotion and pulled over to intervene, and then the patient attacked the second first responder with pepper spray. So the female EMT who was in the back helping, her stab wounds underwent successful surgery and is expected to make a full recovery. And the male EMT driver was taken and treated at the hospital and released later that day. So they both will have full recoveries and be okay. But it said that the patient, or also known as the attacker, she was charged with assault with intent to murder as well as other charges. And they say that officials still have not confirmed what weapon was used to stab the EMT. They said that a pair of scissors were found on scene, but they still have not confirmed anything. So this relates to my community because one of me in the fire service will be providing care to any and all patients of many different kinds. And in this case, a psychiatric patient almost cost this EMT her life when she was just trying to do her job. So if I were in that situation, any type of hints that anything a little sketchy, I would definitely want to note. Or if I did not feel comfortable with this patient, I would remove myself because your safety is more important than anything. And if you don't feel like it's right or something's wrong, I do my best to remove myself from that situation. But it shows that these things happen. This EMT is just doing her job, and something triggered this psychiatric patient, and it almost cost her life. So, yeah, that's really this current event. So thank you, guys.